This is One-on-One. Hi, I'm Steve Adubato, coming to you from the North Ward Center in beautiful Brick City, Newark, New Jersey. This is part of a series about autism, a different way of thinking. We're honored to be joined by Dr. Corinne Catalano from Montclair State University. Your title is so complex, I'm gonna let you tell us. It is?
I am the Assistant Director for Consultation Services at Montclair State University's Center for Autism and Early Childhood Mental Health.
That is not all on one card, is it?
It is, small type.
Give our best to Dr. Cole up there, the president.
I will, for sure.
A lot going on at Montclair State, but one of the areas where you're recognized for is your research, the focus on autism.
Yes.
One of the things, and Corinne is joining us for a roundtable discussion on autism, but I'm curious about something. Why is it that boys are diagnosed earlier and more often than girls when it comes to autism?
Well, there's probably a lot of reasons for that, some of which may be based on what autism really is, which we're starting to learn that it is a neurodevelopmental disorder.
Define that.
A neurodevelopmental disorder means that it's a disorder of the nervous system, right? Oftentimes we think of autism as a behavioral disorder, and I think that is right now how we're diagnosing autism, by looking at sets of behaviors.
Right.
But where the research is really going, and what might give insight to boys versus girls, I'm not sure, is that we're starting to really understand autism as a disorder of our nervous system. And so research that's being done now by Dr. Liz Torres at Rutgers and the head of the New Jersey Center of Autism Excellence is neuroscientific research.
Why does that matter? Break it down. I mean, that's,
Sure.
I appreciate the clinical research-driven focus of that.
Right.
But break that down in terms of what that could and should mean to those who care deeply about those who are dealing with autism and their families. How does that, why does that matter?
Well, autism spectrum disorder, hence spectrum, lets us know that this is a really heterogeneous disability category at this point, right? I've worked with so many kids who have this label, if you will,
right.
Some of whom are very verbal, some are not verbal, some of whom have high intellectual ability, some who don't, some who...
It can mean different things for different people diagnosed with autism.
Right, and so what we're really trying to understand is what is going on that causes an individual to have the criteria of behaviors that we see that land them with this diagnosis. What is going on in our nervous system that leads a person to have challenges with social communication, that leads a person to have restricted, repetitive behaviors? Those are the two criteria behaviorally that get you the diagnosis. So the research is really going in this direction of trying to look at the internal workings, what is going on inside individuals who get this diagnosis.
Let me try to bring it down a little bit to a question that I keep pondering, and I'm sure a lot of folks watching right now, listening right now, are thinking about. Why is New Jersey's rate, or the rate of autism diagnosed in New Jersey, much higher than virtually every other state in the nation? If we're not number one, we're number two. I don't know.
We're number one.
We're number one.
Pretty significantly, because we shine a light there.
This is a good thing?
This is yeah, I think it's a good thing because people are getting services that they need.
That we have the highest rate of autism in the nation is a good thing.
Well, it's a subjective diagnosis at this point.
Subjective.
Subjective.
Translate that.
It means that it's based on looking at a set of behaviors and saying, yes, this child qualifies because I see those behaviors.
And would someone else potentially not see or diagnose it the same way?
Could be. And if there's not enough people who are looking and referring children to get those diagnoses, then many children go undetected, who may, in this state, receive the diagnosis. We have a huge disparity in this country between the numbers of children in New Jersey who are diagnosed and the number of children in, say, Alabama who are diagnosed.
So in Alabama, for argument's sake, where we're not seen, just want to clarify that, those children who are dealing with autism and their families may not be getting the services they need because they haven't been diagnosed.
Right. Right. And so I would say your question, is it a good thing? Yeah, it's a good thing that New Jersey has such a focus on this. And we should, as a state, be proud of that.
Let's talk about, listen, I use the word integration. I'm sure you'll correct me, it's not the right word. The whole question of having a 10-year-old diagnosed, there's no quote there, it's diagnosed with autism, somewhere on the autism spectrum, in a classroom, with other students who have not been diagnosed, versus that 10-year-old being in a classroom with others who have been diagnosed with somewhere on the autism spectrum. Long-winded question, trying to ask, what's better for that student?
Right, right. Well, 10-year-olds late to start inclusion, right? And what we at Montclair State really focus on is inclusion for children with autism and other identified disabilities right from the start, as early as childcare, right? As soon as a child has identified disabilities, at Montclair State, we have the Ben Samuels Children's Center, which is a model inclusive early childhood care and education center.
You have children together.
Children together, right from the start.
What do you see?
What do we see? We see.
What are the benefits?
The benefits are language models, right? Children who are typically, and I will put that in quotes, developing, who have lots of functional language, lots of wonderful social engagement skills to model for their peers. We have curriculums.
What does it do for the students who are not those who have been diagnosed with autism? What does it do for them?
Well, there's wonderful research about the empathy and compassion and embracing of diversity of all sorts that really is fostered by having children, again, from the earliest parts of their educational experience included. Is
that approach at your university atypical for how others in the autism community, I'm not sure if there's a community, but there are lots of folks who care deeply about those who have autism. Is it the exception or the model to bring people together?
Unfortunately, in New Jersey, it's the exception. One thing about New Jersey that we need to I think, accept is that while we have the highest incidence of autism, we're also among the lowest in terms of our rates of inclusion of children with disabilities.
Really?
Yes.
Let's make sure that that is a point that you bring up in our 10-person panel discussion.
Sure.
It's a two-parter that looks at autism from a variety of perspectives. Corinne, thank you.
Thank you.
We appreciate it. Well done.
Okay, thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Turrell Fund, supporting Right from the Start NJ, the Healthcare Foundation of New Jersey, the Robert Wood Johnson Foundation, the Northward Center, RWJ Barnabas Health, TD Bank, and by Adler Aphasia Center, promotional support provided by New Jersey Monthly, and by the New Jersey Business and Industry Association. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.